pituitary is a very important and like a master gland in our body. It controls the various function and hormones in the body overall. It's in a brain, and it's even though it controls and it's like a master, even though this pituitary itself is controlled by hypothalamus. So just a recap about this anatomy. But this pituitary is like a master gland, so remember. But even though it controls everything, this is a very small organ. It's like a pea-sized organ in your brain. That's why I put this very small organ. So, and thyroid is controls all the metabolism in the body. And this, when you think about thyroid, it's like a butterfly-shaped organ, gland on the front of our neck, and it controls all the metabolism. Let's see what are the different categories of drugs under these sections. So, let's see the different categories of these drugs. Yeah. So pituitary and thyroid. Remember, just we are on pharmacology part 2, endocrine drugs, pituitary and thyroid. Different categories are: first one is hypothalamic and anterior pituitary hormone. Some examples are human chorionic gonadotropin, it's very popular, it's called as HCG, leuprolide, octreotide, like IDE, octreotide, somatotropins, like very important part of the growth hormones. So they are very important in controlling the growth hormones of the posterior pituitary. There is anterior pituitary and posterior pituitary. Okay, so we know how they are synthesized and stored everything. So main majority of the hormones of the posterior pituitary are very popular, and then I can see that iron, like desmopressin, oxytocin. It's very important during the labor. Oxytocin helps with the labor contraction. Vasopressin, it controls. It's like antidiuretic hormone. It helps to retain the water in the body. Okay. So next category is drugs affecting the thyroid. The thyroid, it controls the metabolism, and there are diseases that cause the thyroid issues, and they can have lower thyroid, like hypothyroidism, and higher thyroid, hyperthyroidism. So again, we are know from the physiology how the iodine is important in the formation of thyroid hormones, etc. So what are the drugs will be beneficial for this sort of patients with the thyroid issue? Iodine and potassium iodide, depending on your levothyroxine. Levo means like elevate, like if you have less thyroid, you need to elevate your thyroid levels. So you take levothyroxine, methimazole. Okay, if it has higher thyroid, you need to lower that. Higher thyroid is hyperthyroidism. And there is propyl thiouracil, PTU. Just remember that this drug P and P1 movie is very safe to use during the pregnancy as well. Propyl thiouracil. Okay, that's it. Thank you. See